Hello, this is Roger Hayek, owner of Hayek Insurance. I wanted to give you a nice tutorial on covered California health insurance with regards to premium assistance and more. So let's jump right in. You can visit us at hayekinsurance.com for details. You can call us at 800-860-8835. We do not charge for our services. The amount that you pay for your health coverage is the same with us as it is through Covered California. Before we get into the quote numbers, I wanted to show you here about the income guideline chart. Let's take a look at this first. So this determines where you're going to fit in with regards to premium assistance and enhanced benefits, which we'll go over in a moment. In addition, depending on your family size, if you've got youngsters or pregnant women in the household, the income guidelines are adjusted for those. So as an example, a two-person household with less than $23,792 of income will be eligible for Medi-Cal. Visit our website for more details about Medi-Cal. If it's a two-person household and the income is above this number but below this number, then you may be eligible for premium assistance and be able to choose traditional health insurance with one of the major insurance carriers. If your gross adjusted income falls in this range here, then not only will you get the premium assistance, but if you choose the silver plan, you will get what's called enhanced benefits. Your deductibles and copays are lower. Let's take a look at the health benefits table. This is the bronze level of coverage. Doesn't matter if you choose Oscar or Kaiser or Blue Shield or whoever. If you choose the bronze plan, these are your benefits. If you choose the silver plan, these are your benefits. So the bronze plan, you get a free physical, you get 3 doctor visits, primary, urgent, or specialist. You have this $40 for unlimited labs. Everything else in white is going to be subject to meeting the deductible, which is an out-of-pocket of $7,800. If you choose the silver plan, you're going to get some more benefits before meeting the deductible. Free physical, doctor visits, unlimited urgent care visits, specialist visits, emergency room labs, x-rays, imaging. You have a lower deductible for prescriptions, $300, and these are your copays for brand name prescriptions, $16.90 or up to $250. With those lower income ranges, the silver 87 and the silver 94, you're going to see much, much lower copays and most importantly, a much, much lower out-of-pocket. One very, very important thing to remember is that all plans include the 10 essential benefits, the 10 essential health benefits. So whether you choose the bronze or the silver or the gold or the platinum, you're getting the exact same benefits. You're just subject to different costs of insurance and different deductibles and copays. But they all cover the same things: prescriptions, labs, x-rays, surgeries, hospitalization, maternity, and so on. Alrighty, let's get into the shop and compare. Let's do a simple one. We'll go ahead and throw in a local zip code here, and we'll say, a minimum wage person that is a single tax household that's in their age, let's say 30 years old. And let's take a look and see the results here. So as you can recall from the income guideline chart, this person would be eligible for enhanced benefits if they chose the silver plan. So we like to sort it here by monthly premium. The lowest cost bronze plan is right here with Oscar, $18.02 per month. Very affordable, great coverage, high deductibles and copays, but great coverage. Let's take a look at the silver options. There we go. There's the silver with Oscar again. It's $98 per month. And as you can see there, you've qualified for the silver 87, which based on this benefit summary here, you'll see the silver 87's got much, much lower copays and deductibles and a much lower out-of-pocket. All right, so let's shoot back. So this person is getting $223 a month in assistance, but what happens if this person ends up with an income of $26,000? Now, at tax time, when they file, if their income is higher than what was estimated, they're going to be getting a tax debit. So from $223 per month, they are now eligible for $180 per month $181 per month. So what's that? About $45, $43 of debit, tax debit for each month insured. So if they're insured for the whole year and their income was estimated at 22 and they were getting $223 a month, they ended up with 25,000 of income or whatever we said, you get the idea. If your income is lower, then your tax credit, then your premium assistance increases in the form of a tax credit. All right, so that was a simple one. Let's go back and do a little bit more difficult situation here. What we call a mixed household. A mixed household is when children are eligible for premium assistance, but the adults are eligible for traditional health coverage. So if you recall in that chart there, that gave us a little bit of information about who qualifies for what. There we go. There we are. So this family of 4, which only 2 members get the traditional health insurance, and then the 2 children would be enrolled in Medi-Cal, are getting $468 a month in assistance. And there we are, $77 a month for the bronze, on up from there, different insurance companies. And then here's the lowest cost silver plan would be something like $258 a month for the both of them. That's with the mixed household. Now, if that family has a little bit higher income, like $71,000, that gets the kids out of Medi-Cal and into the traditional health insurance with the family. And we're looking at $667 a month in assistance. And the whole family can have the bronze plan for around $200 per month, or the whole family can be on the silver plan for about $500 per month. It's getting up there in price. We'll talk to you more about benefits and coverage and so on when we speak, but this gives you kind of an idea, general overview. Now, let's say you've got a family of 4, and let's say dad is 67. He's on Medicare, so he doesn't need coverage with Covered California, and mom is included, and we got a couple of 20-somethings in the household, 23, that kind of thing. So now let's take a look and see what happens now. There we go. So now they're getting $888 per month in assistance. Different kind of a scenario here. 3 members included, 4 in the tax household, but 3 members included. And there's your monthly costs going up from there and so on. So that's it in a nutshell, folks. I'm sure you'll have more questions. You feel free to give us a call at 800-860-8835. Please hit that like button and subscribe to our channels. We have more videos coming every day. Thanks so much.